How is it that parents can go about finding the right doctor and the right care team?
Well, with Lennox Gastaut, there really is a multidisciplinary approach to medicine here. Many different doctors of many different disciplines. The key is to bring them all together and making sure that they are communicating with one another. One of the tips that I've given parents, and one that has been used with my family, is just carrying around a marble notebook or a 3-subject notebook and making notes every time you leave one doctor and showing it to the next doctor. So your neurologist knows what your dietitian said, and your gastroenterologist knows what your neurologist said, and so on and so forth.
Sam, finding the right doctor was a challenge for you, isn't that right? Can you tell us what would be your advice to other families as they go through that process?
Well, I think you need to communicate a lot with the doctors. My challenge was initially when he was diagnosed, most of the time when you go to a doctor, you're listening a lot. You know, the doctor's giving you advice because that's their expertise. But I found myself with a lot of questions. I did a little background check meaning about the hospital, about how many children have they treated in this age group.
I would second something that Sam said, that communication is essential. There are people physicians, who know all about epilepsy. And this is a complicated illness, and I think that we owe it to the family to not only treat the epilepsy, but to make certain that the families are comfortable with what's going on.
Dr. Roach, as children grow through their teens and their 20s, normal health issues around growth and hormonal changes happen, and they add some urgency. How should parents approach things like that, like reproductive care, bone health, drug interactions, and so on?
Well, you're going to have to individualize it for the patient. If it's behavioral, oftentimes that translates into having still another person on your team, a psychologist, a psychiatrist, or someone like that. Behavioral issues are a huge problem sometimes. Reproductive issues, honestly, it depends on, what the individual's level of function is and so on. These children, adolescents, are going to need, of course, the same care as everyone else. None of the LGS makes the routine care go away. They still need vaccines and flu shots, and they still get ear infections and pneumonias and so on. And then one thing that Christina said earlier that I would second is there's a huge value for parents in talking to other parents, because some of these issues, they're not new, and there's no sense making the same mistakes or having to create the same solutions when you can talk to someone who's been there before.
So Sam, talking about this transition process, is there anything that makes you nervous going forward?
Yes, I don't trust a lot of people with my child. I'm very cautious, extremely. Just I can be overbearing when it comes to that, because I want that job. That's my job, and that's the greatest concern in giving that up. Who do I allow my responsibility? Who do I let be in the situation? And that's going to be real hard for me to take on that hurdle.
Dr. Roach, how does the transition process affect the person with LGS?
Some of the individuals get very attached to their pediatric team, and so just the breaking of the bond is often traumatic for both the individual and the family. And I got to tell you, sometimes it's a little bit traumatic for the doc, to wave goodbye, to them as well.
Dr. Roach, when you feel your patients are ready for the transition, how do you bring the parties together as part of the team?
I like to give the family more than one name of people in the area that I know. And then partly it's a matter of making sure that that doctor accepts their insurance, things of that sort. That's a big burden sometimes, because many children have Medicaid coverage. Well, the simple business reality for a lot of adult neurologists is that they really can't accept that, or they don't, and so that means that there's a void of coverage for the children who have Medicaid in many instances. The reality is Medicaid, while it's coverage is better than having no coverage, it really doesn't fully cover the costs to the doctor for outpatient care. They have to cover their costs, and if they spend an hour with a patient and don't make enough money to cover their costs, then they will have no practice. And it's a barrier, I think, to successful transition in some instances.
You spoke about that you went through various doctors, and what did you feel that was the best approach? Was it communication?
Yes, it was. My thing was, and I would give that advice to anyone else, don't be afraid to interview the doctor. Don't be afraid to ask questions, because again, we are the voice. I am the voice for my child, and I have to be that voice.
Well, do you have any apprehensions, though, going forward and switching from the pediatric to the adult neurologist? What do you feel about that?
I'm feeling better about it, because I'm a very detailed person, and we've had a daily log for about 6 years now. And I can go back and tell you how DeMarcus had a good day 3 years ago, different things that affects his disorder, like excitement and things of that sort. I want to be able to share those things with his adult doctor.